The world is awash in suffering. Millions are displaced, fleeing violence, persecution, and the increasing devastation of climate change. They seek refuge, hoping for safety and a chance at a better life. Instead, they often find themselves trapped in overcrowded camps, facing hunger, disease, and despair. The scale of the crisis is staggering, with over 100 million people forcibly displaced worldwide. This essay will examine the particularly dire situations in Sudan, Chad, and Yemen, shining a light on the humanitarian crises unfolding within their borders. Across the globe, refugee camps struggle to cope with the sheer number of people seeking shelter. Resources are stretched thin, leaving many without adequate food, water, or medical care. The most vulnerable, particularly women and children, are at even greater risk. They face increased threats of violence, exploitation, and trafficking. The stories that emerge from these camps are heartbreaking, a stark reminder of the human cost of conflict and displacement. In these forgotten corners of the world, hope can seem like a distant dream. Yet amidst the hardship, there are also stories of resilience, of communities coming together to support one another, and of individuals fighting for a better future. It is these stories that remind us of our shared humanity and the urgent need for a compassionate global response. We cannot turn a blind eye to the suffering of millions. Sudan is a nation teetering on the brink. A brutal civil war, erupting in April 2023, has plunged the country into chaos. The conflict between the Sudanese armed forces and the Rapid Support Forces has resulted in a catastrophic humanitarian crisis. Millions have been forced from their homes, seeking safety from the relentless violence. The United Nations estimates that over 12 million people are internally displaced within Sudan, while another 4 million have fled to neighboring countries, primarily Chad and South Sudan. The fighting has left a trail of devastation in its wake. Homes, schools, and hospitals have been reduced to rubble. The economy has collapsed, leaving millions struggling to afford even the most basic necessities. Food insecurity is rampant, with over 635,000 people facing famine conditions. The situation is particularly dire for children, with malnutrition rates soaring to alarming levels. The World Food Programme warns that without immediate intervention, Sudan faces a humanitarian catastrophe. The collapse of the healthcare system has exacerbated the suffering. With 80% of hospitals in conflict zones non-operational, access to even basic medical care is extremely limited. Diseases like cholera, easily preventable with proper sanitation and access to clean water, are spreading rapidly, claiming the lives of thousands, particularly children. The international community must act swiftly and decisively to provide humanitarian aid, halt the violence, and help Sudan find a path to peace. Across the border, in neighboring Chad, the Adre refugee camp stands as a stark testament to the human toll of the Sudanese crisis. Overwhelmed by a massive influx of refugees, Adre has become a symbol of the international community's struggle to cope with the ever-growing displacement crisis. Over 600,000 Sudanese refugees, predominantly women and children, have sought refuge in Adre since the start of the conflict. The camp, originally designed to accommodate a fraction of this number, is now bursting at the seams. Conditions in Adre are nothing short of dire. Overcrowding has led to appalling sanitation conditions, increasing the risk of disease outbreaks. Water, a precious commodity, is in short supply, forcing many to walk miles to access even a few liters a day. Food rations have been cut due to funding shortages, leaving many families struggling to feed themselves. The lack of adequate shelter exposes refugees to the harsh elements, with scorching temperatures during the day and freezing conditions at night. The situation is particularly harrowing for women and girls. They face heightened risks of gender-based violence, including sexual assault and exploitation. The breakdown of social structures and the desperation born of displacement have created an environment where vulnerable individuals are easy prey. Aid organizations are working tirelessly to provide protection and support, but their efforts are hampered by a lack of funding and the sheer scale of the needs. While not a refugee camp in the traditional sense, Yemen offers a chilling parallel to the suffering witnessed in Sudan and Chad. Ravaged by a protracted civil war since 2015, Yemen has become synonymous with humanitarian catastrophe. The conflict, fueled by regional rivalries and international indifference, has created one of the world's worst humanitarian crises, leaving millions trapped in a cycle of violence, displacement, and hunger. Over 4.5 million Yemenis have been internally displaced, forced to flee their homes in search of safety. They often end up in overcrowded and underserviced camps, where access to basic necessities is limited. Food insecurity is rampant, with 17.1 million people facing acute hunger. The United Nations estimates that 5 million people are on the brink of famine, a stark reminder of the human cost of this forgotten war. The conflict has had a devastating impact on Yemen's infrastructure. Hospitals, schools, and water systems have been destroyed or damaged, leaving millions without access to essential services. The healthcare system is on the verge of collapse, unable to cope with the overwhelming needs of the population. Diseases like cholera, diphtheria, and measles, easily preventable with proper sanitation and vaccination, have spread rapidly, claiming the lives of thousands, particularly children. The international community must not stand idly by while Yemen descends further into chaos. A ceasefire, followed by a political solution to the conflict, is urgently needed. Humanitarian aid must be scaled up to address the immediate needs of the population. The world cannot continue to turn a blind eye to the suffering of millions of Yemenis.